Hello everybody, thank you for joining me for this month's Body Signals Workshop. My name is Dr. Lazar Jancic from Leederville Chiropractic Clinic, and this month we're talking all things low back related. Anatomy, causes of low back problems, your options, and where chiropractic fits in the whole thing. A lot of you don't know that low back problems are a massive burden on society. And the average person out there knows very little about why they have low back pain and what they can do. So if you do know anybody, any friends or family members that are suffering from low back problems, please pass on this workshop. It may make a huge difference in their lives. And also at the end of the workshop, I'm offering a very, very special promotion for anybody that's interested in getting started and looking after their health and their spinal health. So let's take a look now at the low back, and next month we'll be talking about breathing issues, so stay tuned for that as well.
So this is how a typical low back problem can present in clinic, in practice. Sometimes it's one or two of the following, other times it's numerous. So we have low back pain, of course, tight muscles, lost range of motion, which means reduced mobility, stiffness, leg pain, swelling, burning, numbness, and even pins and needles. A typical scenario is to wake up stiff and achy, sometimes worse later in the day. The worse the problem, the more it will spread out from the spine into the buttocks and legs. If people pay attention, they will notice that often the symptoms of pain will improve with gentle movements like walking and the simple stretches I give them. Low back problems can affect people of any age, gender, or race. It is most common between the ages of 30 and 65. And you can be a contractor, a busy mom, an athlete, an executive, doesn't matter. Here's what I've seen countless times. Low back pain is incredibly widespread. It derails life, fun, fitness, productivity, sleep, energy, life. Unless you've had it, you probably won't truly grasp this. We know it's almost totally preventable and absolutely correctable. But to correct the problem, you must understand the cause. Let's take a closer look at the low back. Here in this middle picture, we have the entire spine from the side view, side profile. Of course, for this workshop, we'll be focusing on that lower back, which is made up of the 5 vertebrae. They are the largest vertebra in the spine simply because they are carrying the most weight. And between each vertebra, you will find a disc. The shape, the C shape of the low back is in itself designed to help to absorb stress and forces and to distribute them between the front of the spine, which is where the discs are, and the back joints, which is where the facet joints are. The disc itself also contributes to shock absorption, but also a critical factor or use of the disc is movement. It's to allow mobility. So it's a very, very special joint and a very nifty design. Something I see a lot in practice is disc herniations, or slip discs as many of you may know them. This is when, through injuries old and new, the rings of cartilage called the annulus fibrosus, which is the outer fibers of the disc, tear and split, allowing the spongy nucleus pulposus to push through and eventually even break through. It's really important to understand that no matter how bad you think it is, the disc can, in most cases, recover substantially. I have successfully treated many, many people with just such problems, and you would not believe the healing ability of the human body. The tearing of these outer rings comes with significant pain, inflammation, and possible direct nerve pressure as demonstrated by this slide. This often leads to a condition called sciatica. Sciatica is when these discs start to irritate the nerves coming out of the spine and cause pain, numbness, and tingling into your buttocks, legs, and feet. It's important to understand that there is nothing wrong with the leg itself, even though that's where most of the pain is felt. This is simply as a result of the pressure on the nerve in the low back, and this is where the appropriate treatment needs to be directed, in the spine, not the leg. Here are some scans of the low back. In the left, we have a normal X-ray. Notice the C shape and the smooth black line indicating the alignment of the spine. The middle is a significantly degenerated low back. You notice that the gaps, the discs between the bones, are virtually non-existent in the bottom two discs and reduced in the other ones. And also we can see that that smooth black line, indicated here with the red lines, is disrupted. That's what can happen with the level of degeneration that this person has, and will create instability. The last picture represents an MRI, again of the low back, and we can see the disc bulging, demonstrated here by these round black balls or shapes. That's the disc literally pushing out and pushing into the spinal cord. You notice here how there is no bulbous black disc pushing onto the spinal cord. And also notice how dark these discs are. They're literally losing fluid, losing water. They're getting drier compared to these discs that show, the white shows more water in the discs, which is a healthier disc. So let's just talk about just how bad low back problems can be. Back problems are actually an extremely common condition, and estimates from the Australian Bureau of Statistics in 2014-15 National Health Survey show about 3.7 million Australians, that's 16% of the population, have back problems. It is estimated that 70 to 90% of people will suffer from lower back pain in some form at some point in their lives. 70 to 90%. One study of people with long-term back problems reported 14% experience constant or persistent pain, and 86 experience pain 1 day per week. Overall, people aged 18 and over with back problems were 2.2 times as likely to report very high levels of psychological distress than those without the condition. Back problems are among the most commonly managed conditions in general practice. About 3.7 million GP encounters occurred in 2015, between 2015 and 16 in Australia. This has increased significantly from 2006 and 7. The impact of chronic back problems is considerable. The burden of back pain and problems is not only high in Australia. Globally, low back pain is ranked highest in terms of non-fatal burden. That's years lived with disability. It's ranked highest. Back problems are associated with a substantial healthcare costs, both in Australia and internationally, with average direct costs estimated to be twice as high for people with chronic low back pain compared to those without chronic low back pain. The burden of back problems is projected to increase. The study conducted by Arthritis and Osteoporosis in Victoria in 2013 projected the number to rise by 31% by 2032, based on population increase alone. Studies find that internationally, low back pain is a leading cause of work absence, inability to work, and premature exit from the workforce, lost productive life years, and receipt of disability benefits. Let's now have a look at different approaches to addressing low back problems. Let's start with the allopathic approach. If you're not familiar with the term allopathy, this is the treatment of symptoms rather than causes, and is quite a common approach within medicine. So if the symptom is back pain, the sole focus of allopathy is to reduce the pain and/or associated inflammation, and only this. Whereas a wellness approach would be more to ask why is there pain and inflammation and to attempt to address the cause. It's quite an important distinction. So some of the most common allopathic options are heat and bed rest, drugs, prescription drugs, steroid injections, which are very powerful pain relievers and anti-inflammatories, different types of pain management, which usually are revolving around medication. There is surgery and perhaps other alternatives. So here we need to be aware of our own goals when we are considering our approach to low back pain and therefore our outcomes. Do we want a pain fix? Do we want to fix the underlying problem? Do we want quality of life? What is the safety and efficacy of our chosen treatment? For now, I'd like to take a much deeper look at the drugs, the prescription drugs and pain relievers. The most common ones that you'd be familiar with are your paracetamols, your codeine or Panadine, dihydrocodeine, tramadol, Nurofen Plus, and some of the stronger opioids are morphine, oxycodone, methadone, and buprenorphine. So let's have a look at some of the statistics about these types of drugs. Here we have the DEA-approved drug production in America. And these are the different types of opioids that we just mentioned, but notice the substantial increase in production since 1993. Unfortunately, in America, 40 people a day will die from narcotic prescription overdoses. Again, from America, the number of deaths, which is the red line, these are opioid-related deaths, are substantially higher than things like cocaine-related deaths, which is the dark blue line, and even heroin, which is the light blue line. So we can see what is having a dramatic impact on deaths and maybe put that into perspective. And what about Australia? Prescription opioids were involved in more than 70% of drug-related deaths in Australia in 2017. The rate of misuse of pharmaceutical drugs in the general population outstrips cocaine and amphetamine use by a significant margin, almost double for cocaine and over treble for amphetamines. I guess if you're not hearing this, the biggest problem with opioids are their addictive nature. This is why opioids are such a big problem. And they're masked by being, people see them as being relatively innocent because they're prescription drugs. So they're kind of allowed, they're okay. But we saw the previous graphs about just how much damage they're doing around the world. You may have seen this in popular media. This is why these problems are considered to be the biggest threat that our countries are facing today. You don't really hear about this much in the news though, do you? I wonder why that is. And most people have no idea that we are in the middle of a health crisis. We now have a drug culture instead of a healthcare system. People are taught that drugs are the first and best choice for managing health, for every problem there is a pill, for every pain a drug, and do we really think this is going to end well? Do you think there might be a better way? Let's next have a closer look at surgery as an allopathic option. Remember some important questions about safety and efficacy? Does this look like a good option to you? Sadly, the science is not supportive at all of back surgery. Let's have a look at the evidence. According to the respected journal Spine 36 in 2011, regarding low back fusions, only 26% of those who had surgery returned to work within 2 years. 67% of those who did not have surgery returned to work within 2 years. So 26, the people that had surgery, only 26% returned to work, and 67% who did not have surgery returned to work. 36% of surgeries resulted in a significant complications. 27% of those who had surgery had to be reoperated on due to symptoms and/or complications. Here is some more from Journal Spine 8, 114 to 120. There are still no clearly defined clinical practice guidelines related to surgical intervention of chronic low back pain in the absence of serious structural disease such as instability, infection, or neoplasm. So basically, unless you have instability, infection, or cancer, you should not have surgery. There's got to be a better way than this, right? I think it starts with maybe some better questions like, what are the risks of these procedures? The costs involved? What are my expected outcomes? If you're ever considering some of these options, ask to interview 10 of the surgeon's patients. Definitely have a look at the research and consider your options very strongly. Is this treating your symptom, or is it actually going to correct the cause of the problem? Back to our patient's symptoms now. These are symptoms of an underlying problem. That low back pain you're getting is a sign, it's a body signal of an underlying problem. You see, symptoms are warning signs from your body. We like to call them body signals. They are communications from your body, begging for mercy, begging for you to stop doing something that is hurting you, or start doing something that is good for you that you have not been doing. Sometimes the body whispers, and sometimes it screams, and sometimes it just flattens you. Has anybody ever had that moment, 1 second you're fine, then you decide to pick up a wet towel off the bathroom floor, or take your car keys off the ground, or that mattress that just had to be flipped, and the next second you are looking at the ceiling, grasping your low back, wondering what on earth just happened? How is life the next few days after such an injury? You see, your body signal or your symptom is just the tip of the iceberg. It's just an indicator to what's really going on below. I'd like to just briefly talk a little bit more about symptoms and point out to people that in reality, health is like a spectrum. If you are having signs and symptoms, you're further down the spectrum than you think. You see, in this spectrum here, you have on the far right, you have high level wellness. On the left, you have death. Here you have disability, symptoms, and signs, and this middle point is the neutral point. That's where you don't feel anything. To the right of that point is where you start to move towards wellness. So having symptoms and body signals is giving you an idea where you are on this program, on this spectrum. It's also important to point out that any allopathic approach is really intervening here, isn't it? And when do they stop intervening? Here. As soon as your pain is gone, their job is done. So what are you really doing? What are you really looking for? It's very important to be aware of this. Ask yourself, where do you fall on this continuum, on this spectrum? What direction are you headed in? At what speed? This is why we encourage people to speak body, to learn to interpret your body signals, make sense of them, and use them to your advantage, helping you to make better decisions and choices. So now let's have a look at the causes of low back pain. Like most things, it's simply lifestyle stress. We like to call them the 3 T's. You have your thoughts, your toxins, and your traumas. For the purposes of this workshop, I won't go into great detail into all of these, but it's pretty straightforward. Thoughts are things like you being unhappy, having negative thoughts. Lack of sleep will certainly create a significant amount of stress. Constantly rushing, this is a big problem in our society. Worrying, maybe even loneliness. These all constitute stress in the thoughts department. Toxins, that's your toxic chemicals like pesticides, smoking, other toxins. We have heavy metals, and sugar, believe it or not, is a toxin to our body, particularly in high doses. Then there's grains and dairy. That's a bit of a shocker to many people. And any kind of nutrient deficiencies. These all account for the toxins side of stress. And then, of course, we have traumas, physical traumas. This is probably one of the more relevant factors for spinal problems. And within traumas, we have macro and micro traumas. Macros are your significant injuries, sporting injuries, car accidents, slips, and falls. These are the obvious physical stressors, and they can often cause pain and obvious signs of damage, and can be very serious, but they can also cause something that may not be so obvious. Next, we have microtraumas. Microstressors. Does this look familiar? It's all too common these days, and we're all guilty of stressing our spines with these factors, these postures, these microtraumas. Looking down at various screens creates an incredible amount of pressure and compression of your spine. We all do it, don't we? But it's starting even earlier with the kids these days and becoming more and more prolonged as our sedentary lifestyles become worse. And the most damaging form of microtrauma, sitting. They're saying now sitting is the new smoking, with latest evidence showing that excessive sitting is literally as bad for us as smoking. That's pretty scary considering how much of us sit and for how long. Experts tell us that we are spending the majority of our waking lives sitting, averaging 8 to 10 hours a day, now 7 days a week. This is directly related to an increase in obesity, diabetes, heart disease, and statistically, a shorter, sicker life. And to make matters worse, we are spending most of that time sitting in front of a screen. This, my friends, is the leading cause of increased stress on our bodies in modern life. This is the most common microtrauma, the biggest source of stress people face today. So all these stressors combined, traumas, toxins, and thoughts, they cause a damaging condition in your spine called subluxation. This is very relevant for your spine and for chiropractic. Subluxations are stiff, rusty, immobile joints in your spine and pelvis. Here's what happens in subluxation. You have joint misalignment, you have soft tissue damage, and therefore inflammation and nerve irritation, muscle spasm, lost imbibition. This is the pumping action in discs, which circulates blood flow to and away from the disc. Lost imbibition means greater deterioration and dysfunction of the discs, and is the main reason why sitting is so damaging for our spines. Also part of subluxations is joint fixation, and with joint fixation comes elevated stress hormones being released by our brain
and body, ultimately resulting in a gamut of physiological responses that you can see here if you pause the slide. I have gone through this slide in more detail in previous workshops, but there's many physiological things that take place in the body. But ultimately, from a spinal perspective, this leads to more tension, more stiffness, and a greater or an increased rate of wear and tear, complicating the low back condition.
Now, before we take a look at chiropractic safety and efficacy, some of you might be wondering if you have a subluxation, and how will you know if you have a subluxation? Well, just like you need a dentist to check your teeth for cavities, you need a chiropractor to check your spine for subluxations. I, as a chiropractor, have studied 5 years at university and spent hundreds of hours, of additional hours, learning about the spine and spinal health. Now, just so you know, as a special promotion for this workshop, I would like to offer my listeners and your friends and family a 50% discount off my initial consultation, which is normally valued at $120. In this visit, you would know exactly whether you have subluxations and how chiropractic can help. Now, earlier we looked at some allopathic approaches to low back pain. Let's now have a look at the chiropractic approach and see what some of the evidence says there. So here is a little information about chiropractic safety and efficacy. There's a famous report called the Manga Report, which was performed in 1993. And according to this report, which was an independent report commissioned and paid for by the Canadian government, so no chiropractors involved directly in this report. So these guys did an exhaustive review of all the available literature at the time, and these were their summary. This was their summary. Number one, the effectiveness and cost effectiveness of chiropractic management of low back pain, the untested, questionable, or harmful nature of many current medical therapies, the economic efficiency of chiropractic care for low back pain compared with medical care, the safety of chiropractic care, and the higher satisfaction levels expressed by patients of chiropractors. Together, this evidence offers an overwhelming case in favor of much greater use of chiropractic services in the management of low back pain. Dr. Schifrin, LG, who is both an economist and a clinical professor of preventive medicine, evaluated mandated health insurance coverage for chiropractic treatment. He said, a fair interpretation of the evidence accumulated to date indicates that the impact of chiropractic mandates comes close to the best case scenario of low costs and high benefits. Mosley, C.D. et al. From the American Journal of Managed Care in 1996, after analysis of claims over a 1-year period in which patients were permitted direct access to either primary care, gatekeeper physician, or a participating chiropractor for back and neck pain, said chiropractic care was substantially more cost effective. So we have lots of evidence. This is just some snippets that I found, but we have lots of evidence supporting chiropractic care and the effectiveness and safety of chiropractic care. Its track record is quite remarkable, particularly when you look at safety compared to the allopathic approach. Now, as always, I want to equip you to get better results. And as usual, I will take the traffic light approach. There are things that you will need to stop doing, things that you will need to slow down and reduce, and things that you will need to start doing to improve your spinal health. It is different for everybody since we have unique lives and lifestyles, but essentially you want to stop or slow down those stressors that we talked about, as many as you feel you can. It's a work in progress, so you can't be too hard on yourself. The main ones are the dietary toxins and emotional stressors. Many people think they can't change their current situations, which are causing them stress, but you'd be surprised just how much say you have in the matter. One of the key ingredients in a healthy spine is movement. This is where chiropractic care and an active lifestyle are critical. Before you get active, however, I would strongly recommend you get checked by a chiropractor, as you want to make sure your spine can handle the activity you'll be doing. Having subluxations in the spine will increase your risk of injury at the gym or exercise, and that is the last thing you want, to be put off or slowed down just when you're trying to do something healthy and positive. I often like to think of this combination as the three-legged stool. So each leg of the stool represents stability. Without all three, you don't really have a stable stool, do you? So one of the legs is adjustments in rhythm. We know that the power of chiropractic is in that repetition and consistency. So that's what we mean by adjustments in rhythm. Number two, or the other leg, breaking bad habits. And number three, the third leg, is exercise to strengthen. Once you cover these three bases, you will very quickly move towards a strong, healthy spine. And that's what we want.
So this brings us to the end of this month's workshop. I really hope you enjoyed it. Next month, we'll be talking all about breathing issues. So keep an eye out for that. Until then, this is Dr. Lazar Jancic from Leederville Chiropractic Clinic.